Good morning, everybody. Welcome. It's Nissa, the hypnobirthing midwife. We've got a wonderful, wonderful guest, dear friend of mine today. We're very lucky to have her. I'm going to hand it over. Welcome, love.
Hi, Nissa. Oh, it's lovely to be here and with all your lovely mums and mums-to-be. So, yeah, we had a little chat before. We thought today just talk a bit about healing and health after birth. And I'll just say a few things about it from kind of a physical, emotional and spiritual aspect. So before that, I'll just do a little bit of background on myself for those of you who don't know me. I'm an osteopath living in Walthamstow, and for those of you who don't know osteopathy, it's an amazing training and profession where you get to look at the whole body. Often people think it's just about backs, but it really is about the whole body, the whole structure, function, how it all works, and it's about finding optimal health in the body. And we work through we always love our anatomy and physiology and really getting deep understanding about how we bring optimal health into the body. So that's my background and what I trained in, as I work in, and I've done then on top of that a lot of postgrad training in women's health through all the different phases of a woman's life. But sort of my passion has really been in pregnancy and postpartum, and I've done a lot of additional trainings in that area. And I've really been kind of working with all that and blending creating my own, weaving my own basket as well with all this, with a lot of stuff I've brought in from my kind of spiritual growth, and all the different amazing teachers I've worked with around the world. So I've kind of forming my own version of all this. Anyway, so if we want to talk about health after birth, I thought I'd talk through just some of the tools that I commonly use with a lot of mothers. And so the first tool I'm going to tell you about is, I call it you want to just make sure everyone's on mute, Nissa. The first is about just getting you to say 3 statements, and those statements are, and you can all do this with me now if you want, but it's kind of, and for those who've had their babies. So you're reflecting on the birth, and you're going to say the 3 statements are: I am safe, my baby is safe, and the birthing process is complete. So those 3 statements are really, really powerful statements really powerful statements to give you a chance to just reflect on how you're feeling about the birth. So if you've not yet had baby, just make a note of those statements, and you can say those to yourself afterwards. And if you say them and they all sound completely true to you, and they sound like present and all good, then that's great, they're all true. What I often find in a lot of the women who come to see me is that maybe one or more of those statements don't yet quite feel true, and so that's a really good just observation to make. So it might be that something happened in the birth where you were worried about baby safety, and that happens commonly if there's maybe been a separation briefly at birth or some kind of complication. It might be you're not still feeling quite safe in your own body, and that again might be something that happened to you in the birth. I come across a lot of women, maybe you've had hemorrhages or something. So and then the third is feeling like the process is actually complete. And again, we don't often step back to think about that, but although our babies have been born, if the sort of process, the flow has in some way been interrupted, our bodies and our pelvic bowl might not yet know in itself. Like, we can rationally say in our head, yes, it's complete, but our bodies don't yet know it's complete. So again, just observing that. If you find information, and you can just say all statements, or maybe if one of them is particularly relevant, say that one statement. So I am safe, my baby is safe, and the birthing process is complete. And that repetition in itself is going to help. There's a bit of light here either. Anyway, so yeah, those statements are good. Then the next part you can do is what I call is kind of tapping into the birthing field. So is that something you work with, Nissa, or talk about at all in your trainings? No, okay. So I'll just explain a bit about the kind of concept behind it. The idea of the birthing field is that it's, and this might sound a bit kind of woo-woo to some, but I work with this a lot, and it is very palpable. You can really feel it. And even if you can't, just kind of using your imagination works as well. So the idea is that there is a birthing field which opens up as we come into this world. And that opens up in a channel through the mother's body. And we'd call that the birthing field. And it's just, I think, a really beautiful concept, apart from anything else, that a soul has chosen you to be their mother, and that their energy flows into you, and then you get to release that energy out into the world. And it's something that can be used a lot in the birthing process. It's a really powerful tool to sort of tap into that energy field. But it's really powerful to tap into as part of the kind of birth healing process as well. So again, it's something I use a lot in my practice. So I'm just thinking if there's maybe a little visualization we could do of that. Yeah, okay. Let's spend a couple of minutes just visualizing that. So we'll go into, if everyone is happy to, we'll go into like a couple of minute meditation on that, okay? So, so if you're all probably at slightly different stages. So if yeah, that's fine. I am going to be talking about just briefly about kind of opening up the pelvic bowl. If you're still kind of quite a way off delivering baby, you don't have to kind of obviously visualize that opening too much, but right, so you can, if you just sort of settle inside yourself, you can close your eyes, and I want you to just start tapping into this birthing field. So you might sense it as a golden light somewhere outside of your body. And you're tapping into it, like your baby's birthing field. And you're going to visualize this golden light flowing towards you and into your body and down into your pelvic bowl. And then just releasing out through your body and just in an arc onto your chest. And you're just sensing this flow going through your body. And it can feel relaxing, it can feel kind of tingling, glowing. And just connecting into your body, and you can connect as you're doing that into the bones of your pelvis, and you can visualize them just melting away, just seeing the bones as just a molten lava just melting away. And then you can sense into your cervix and your birth canal and just sense expansion there. Bringing your breath down into your pelvis. And then just sensing that energy releasing out through your body. And then it's nice just to maybe visualize baby's kind of energetic body just flowing out of yours. And just feeling the flow of oxytocin through your body. And then just feeling baby just on your chest. Just remembering that moment you first met. And just allowing that flow of oxytocin just to flow and surge through your body. Feeling that deep connection with baby. Okay. You just want to just all come back. How's that, Nissa?
I didn't really want to come back, I have to be honest. I could have happily stayed there probably for quite a long time.
So there's lots of things you can do with that birthing field, but just connecting with it really at any point in time is a nice kind of memory for you. You know, if you had a beautiful expansive birth, it's a nice memory and brings back that memory and the oxytocin flow. If there was some difficulty in the labor, then just practicing that energy flow, allowing it to release through your body and feeling that connection is really healing for you and baby. And I work with that a lot when I'm treating babies as well, because babies will often feel if there's a disruption in that process. And by doing that, babies are often responding to what they experienced. So it's a kind of way of communicating with each other, like after, about what went on, if that makes sense. So that's a little bit of kind of energetic work that I do. It's slightly difficult to kind of pack that all into a few minutes, but it's given you a little flavor. And then I'll talk briefly about I was thinking about pelvic floor healing as well. So I treat a lot of women with pelvic floor dysfunction after birth, and just one of the main things I see happening is that women are told, firstly, well, all they're told to do is squeeze their pelvic floor. It's just like, we're not given any other message apart from squeezing it. And there's nothing wrong with that message, but it's just not the full message at all. So what's really important, first of all, is connecting with your pelvic floor. So again, I work with a lot of women who've had maybe some kind of level of traumatic birth, and there can often be a disconnect from your pelvic bowl. And doing the kind of thing we just did just then helps to reconnect there. And it's really hard to squeeze and engage your pelvic muscles if you're disconnected. It's like someone can tell you to squeeze and squeeze, but if the brain to the pelvic floor muscles, that if those pathways are not fully engaged, fully connected, then you're not going to get the full power there. So doing some release work actually on the muscles themselves is really powerful. That's a really good thing to do before birth as well, and after birth. So I do a lot of sort of vaginal release work on women after they've had their babies. And what I find a lot of is that there's an imbalance in the pelvic floor, that one part of the pelvic floor is kind of really trying to work hard and another bit is really disconnected. And again, you can't get your full strength if it's not all connected as a whole. If there's been tearing or episiotomy, again, the area of scar tissue needs some release work to fully heal. And the more it's kind of worked on, you can do partner work on it yourself. You can book in with someone who does pelvic floor release work. But it's a really, it would just ensure that your future pelvic floor health is good if you do that. I see women who have maybe had issues with the healing and they've had infections and things like that. And if you've had severe tears, then I would absolutely do preventative work and get work done on your pelvic floor. If you've had very, very minor tears, you won't necessarily need to see a specialist, but just checking in with your own pelvic bowl is really worthwhile. If you want to read more about that, I've written a blog article on my website that you can look at.
What is your website? Tell us, Becky.
www.RebeccaDaviesOST.com.
And when I post this, I will add that so people will see it underneath.
Yeah. So yeah, that's probably been about the 10-15 minutes, I'm not sure. So yeah, I've got lots and lots more I can share, but I think, yeah, I'll open it up to questions now.
Oh, thanks, lovely. I could hear you talk forever. I could say so much, but do you know what? This is for my ladies. So I'm just gonna say it's for you ladies to ask anything that you want to ask. You can shout out and we'll just, we'll interrupt each other, but it'll be fine. Or if you prefer, ladies, you can type in the chat box if that's easier. Completely up to you, and we'll just go for it. So it's anything really up until, well, postnatally until forever, really. Feel free to ask anything that you wish.
I had an antenatal, so I'm 37 weeks tomorrow. And I was wondering about the pelvic floor stuff you're saying, Rebecca, is really interesting. What about kind of advice on what, aside from like you said, all you hear is hold your pelvic floor, try and like tense your pelvic floor, like do your Kegels or whatever. Is there anything else that you recommend doing like ahead of birth to try and prepare yourself for that post-birth?
Well, ahead of birth, I would be doing release work, definitely.
Okay.
So the energy needs to be releasing out of you, and all those muscles need to be letting go and melting away. So you don't want to be thinking about tensing everything at this moment. So I don't know if you've been doing any kind of massage at all. You can do perineal massage and massage on the walls of the vagina as well. Have you done that at all? Yeah, and have you found any tension at all?
The first couple of times were really, really uncomfortable, but it's sort of getting a lot easier now. I found my partner's been doing the perineal massage for me, but it's just so hard to know if you're doing it right.
Okay, so it should just be very gentle. It shouldn't be mechanical either. You're really just trying to feel your body and tune into your body. So if you just imagine there's a clock face, just gently sweeping around one side of the clock face and then the other side of the clock face, and you're just seeing, is there, like, imagine there you're just going around one side like that and the other side, and you're just gently seeing in the walls of the vagina, is there any tenderness? And the areas where they're tender are the areas to work on, basically. Because they'll be the areas that are hypertonic. If you haven't yet had baby, there'll be areas that would be more prone to tearing. So releasing those is really useful. Afterwards, there'll be areas where they're not going to maybe contract as efficiently, or they'll be hyper contracted and they're not able to release efficiently. So when you're doing that release work, I just do it very, very gently and just bring your breath into it. And you're trying to really, really feel. So often so two things we might feel. We might feel tenderness. So that's saying something is overly tight. We might also feel numbness. And numbness is something that is really, really common. With any sort of trauma, we'll disconnect and we will start to feel numb in that area. And I could go into a whole thing about just women and our health and our sexuality, and there's just so much story here, but why women, and I just see it so often, why we are as women often disconnected from that part of our body. So just really, really connecting. Can I feel anything there? Does it actually just feel a bit numb and disconnected? or can I feel tenderness? And either one of those is something to just bringing your breath to that will start to shift things, really. You know, your breath, your loving focus, your attention. There's another piece as well, which is working around the cervix, which is much deeper work and is also really, really valuable. Yeah, that's again where a lot of kind of numbness, tension, disconnect can be felt. So yeah, anyway, I won't go into that now. Does that kind of answer your question?
No, thanks, that's really helpful. And I think interesting what you're saying about numbness, because there's been points where my partner's like said he's like, I feel like I'm pushing really hard, and I've been like, well, I don't feel like I can feel anything. So it's really interesting you say that. And I've been trying to do my breathing, but I think I'll try and focus a bit more on those areas.
And listen to what's coming up in your body, what's coming up in, like, so what images are coming up, what emotions are coming up, what memories, thoughts, they'll all be relevant. And it often, so I do this work called holistic pelvic care, which is all this, it's a kind of a dialoguing with the pelvic floor and about what is the story we're holding in that part of our body. And it's very powerful work, but we will kind of map our own birth there, our, you know, our ancestral history. You know, there's so much we carry around with us in that part of our body. And just to allow ourselves just to connect again and just listen and observe allows us to start integrating again with that part of ourselves. So yeah, that's brilliant that you're doing that work now. It's really powerful. Any other questions?
Hiya, I just wanted to ask a question. I'm not sure if it is in your field, but exercise. So we're kind of like pre-warned and told, you know, you can't do any exercise, you can be incredibly kind to yourself in, you know, post-birth weeks. And I think maybe for my first two, I was, but I'm really, really feeling the lack of my core muscles now, having, you know, a 2-year-old and a 4-year-old to wrestle as well as a 3-week-old. And I'm missing the kind of sense of sort of exercise and togetherness and release. And I just sort of don't quite know whether I should be listening to myself in that, or I should be listening to the kind of accepted guidance, which is, you know, don't do anything for 12 weeks. I think I did, you know, I kept my yoga up. I did sort of 2 or 3 classes a week all the way right up until the day he was born. And yeah, I'm just starting to feel that I might be doing actually more damage by not re-engaging that core, because it just feels like by the end of the day, you know, my back feels broken and my shoulders feel bowed, and you know, I'm not a massive person, and my children are vastly are starting to outweigh me at this point. And I just wondered what your opinion on that was.
Yeah. Okay, so there's no like one rule fits all, and that is the problem with kind of messages we get, like, no one do anything till 6 weeks and then you're all okay after 6 weeks, or, you know, or these very, very generic messages, which we're all different and everyone's story is different. So you've really got to see what's going on with yourself, first of all. So, and it's, I question first of all that what is it you're missing? So there's a few things I picked up there. One was that, so you're feeling your back and everything aching. So that's one thing, which may partly be due to a lack of engagement of the core. We can talk about that, but it can also be down to stiffness and restrictions. So I would say I would start, if I were you, with some stretching, actually. And I don't know if you're doing any stretching at the moment. No, so I would start with that before, because if you're already a little compressed and hunched, and you know, I don't know what your delivery was like, but you know, you're spending time sat in chairs feeding like that, you're going to be developing kind of postural restrictions there. So you want to be doing lots of opening out, freeing up here, you know, bringing the head carriage back, opening through your chest. So I would spend some time each day counteracting what you're doing in this posture by lying on a roller and just really opening and expanding and feeling your chest opening, doing some lovely deep breathing, feeling your chin coming back and lifting. You can do some standing things where you're really just thinking about your alignment, drawing your pelvis back, chin back, and sort of lifting up. There's some really, really good work by a woman called Katie Bowman, all about alignment. She's written a good book. It's called Diastasis Recti. But it's got, so it is for people with diastasis recti, which is the separation of the abdominal muscles. But it's, I think, a very good kind of core strengthening book anyway. But her whole first section of that book is about stretching. That's like, in order to get our strength, we have to have the elongation and the length there. If we're already compressed, we're not going to, be firing our muscles appropriately. And then there's questions like, well, what was your delivery like? Did you have any tearing at all? Did you have tearing in previous deliveries? Have you had any, previous C-sections? What was your, so your whole history before is relevant. That's all the sort of stuff I go through when I would do a consultation with someone. What was your strength like before? What activities were you doing before? So there's all that, and then also it's like, what is it you're really missing? So that one thing you said that was that you're missing, or you're feeling stiff and discomfort. So that definitely needs to be addressed. And the other thing is, are you missing, like someone I was treating recently, they really wanted to get back to running, and she was in no way ready to do running. Like, she'd not long had a C-section and she did not have the core strength to go running. But she was really missing, for her, running really gave her a release of endorphins, and she was really missing the endorphins. So, it's like asking myself, is that part of what I'm missing?
Probably, yeah.
Or am I missing a bit of time out doing something by myself? Am I missing, what is it I really want to envisage myself doing? So for her, I got her to envisage herself running in the forest, was what she wanted to do, and it felt good. But having assessed her, I didn't advise she do that now, but I got her to visualize just going for a walk in the forest by herself. And that felt good too. So I was like, that's something you can go and do. And you're getting that same feeling that you're looking for inside. And so it's thinking, right, what was I doing before that I wanted to get back to? How can I get that feeling? And that I'm honoring myself and where I am at this moment as well. Because you don't need to, at this point in time, be stressing your body out a lot and, pumping it with, getting some endorphins is fine, but you don't need to be on big kind of energy releases when your body is still in it's been through a massive thing, and it's still, and you're producing, if you're breastfeeding, a lot of your energy is going into producing milk, which in Chinese medicine they say that's like giving blood every day. So it's respecting where am I in my energy levels, that I'm not doing something that's going to deplete me, but I'm doing something that's going to nourish me and increase my energy levels. Does that answer your question?
Absolutely. Yeah, no, I think you're probably 100% right. It's a feeling of compression that I need to stretch out, and it's just, I need to identify what exactly I want to be doing, like why I want to run down the street when I really definitely shouldn't. So there's lots of food for thought. Definitely. Sorry, 1 second. One's come to say goodnight.
I suspect a key part for you with 3 children under 5 is that you're really craving a little bit of time to yourself. Which it's like, how can I, what support have I got around me? What's the web of support that I can put around me? to enable that to happen, because that's going to be really important for you to kind of continue to manage what you're doing, is that you really, really nourish yourself each day. So yeah, it's
Thank you, much appreciated.
okay.
Keep them coming, ladies. Anyone else like to ask? Let me just check the chat box. I think we're okay. Oh,
I've got a question for Rebecca, if I may. Hi Rebecca. Hayley here.
Hi.
How are you going?
Good.
Thanks for the talk. It's been great. I wanted to ask a little bit about the oxytocin rush that everybody talks about, but that I don't think I felt after giving birth. A lot of people talk about this amazing, like the smell of your baby and this feeling of like love that just washes over you after birth, or the first time that your milk comes down and you're feeding your baby, and I just haven't felt that at all.
Yeah. So hi Hayley, and first of all, that's let go of any kind of judgment on yourself that you've not yet felt that. I'm going to share a little bit actually with you about I've recently done some work on myself, and it was doing some work on my cervix, and my daughter is 13 years old, and I did some release work about her birth, and I had a huge emotional release, a lot of tears, and really felt like this kind of release of something that perhaps been holding that whole time in relation to her birth. And so that oxytocin and that kind of release can come at any point in time. I know we're going to be doing some work soon, Hayley, so we can definitely connect on all this stuff. But a big factor I see in a lot of mums who come to see me is that we're judging ourselves in some way. It's almost universal that we're doing this. We're holding like, I should be feeling this, or I should be feeling that, or I should have something, as in some way we're judging ourselves. So like a lot of work I do is about kind of forgiving ourselves for our judgments. So if there's anything that we're holding in judgment against ourselves, you just say the statement, I forgive myself for judging myself for. It's almost like imagining if that was your friend, you wouldn't judge them in that way. So why am I judging myself in that way? So that may or may not be part of it, I don't know, but that's a nice little tool to use. And yeah, it might be that just something has interrupted the flow that just needs connecting with. It can be old fears, old kind of wounds that just, it could be an event that happened during the birth. And just kind of coming into connection with that in a loving way just allows that part to heal, basically. And then the oxytocin can start to flow, because we're expanding then into pleasure. But it's like we have to kind of go through our fears in order to expand into that pleasure. So I don't know if that helps at all, Hayley.
Yeah, thank you.
Yeah, anything else about that, or?
No, I was just wondering, like, is it going to come at some point? Like, have I missed something?
No,
does it happen to everybody?
Absolutely have not missed the moment. And those tools that I did earlier, there's 3 statements and the birthing field, just visualizing that flow, start doing that now and just see what comes up for you, and just keep doing it a bit every day. You can even get in the bath with baby if that's now appropriate for whatever stage you're at, and you can have baby just coming out of the water onto you as you're doing that, and just kind of recreating this birth is a really good way of just each time of just letting go a bit more and allowing that the pleasure and the oxytocin to start flow. And yeah, we'll definitely do some work together on that, Hayley.
Great, thank you.
Any other questions?
We're all being very polite. I shall just see if anybody pops up. We've got a nice mixture today, so some pregnant mums and some mum and babes. Oh, I'm gonna come in with yeah, let me come in with something, Becky. How about when you see your ladies in clinic, wonder if you might outline some of the more kind of common things that people come for, and maybe just the kind of approach that might be helpful, you know, what could be done. I'm sure there's a few things that come up quite a lot when women come and see you after birth.
Yeah, so common things are prolapse. So that can be, you know, there's several different types of prolapse. There can be like a cystocele, which is the bladder slightly coming down, the cervix coming down, or the rectum coming down. So cystocele, regular prolapse, uterine prolapse, and rectocele. And so I treat quite a lot of that, and that can manifest like as a feeling of heaviness. It's just to kind of, a lot of women get very, very fearful of it. First of all, if it's something, it is very treatable with the right approach. It's very, very treatable. Yeah, and it's also potentially avoidable. You know, that rest early stages is really, really vital to kind of not overdo things. Basically, in the early stages is really important for your womb health. But it is very treatable, and you know, finding a practitioner that is gonna, yeah, a lot of the problem is medically often all that's out there is yeah, do your pelvic floor squeezes, or if it's really, really terrible, eventually down the line get some surgery. And that's just not the case. I see a lot of it, and it's very, very treatable. You can reverse a prolapse quite easily. Yeah, depending on what grade it is and how severe it's got. You know, early minor prolapse is very, 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 very reversible. So I see a lot of that. I see, you know, kind of weak pelvic floor dysfunction, women who've got issues with continence, urinary incontinence or fecal incontinence. So that's all very treatable. I see women with ongoing pelvic pains. It might be pelvic pain that's developed since the birth, or that was there before the birth and continued. Again, you know, the right practitioner, it's very treatable. You shouldn't be putting up with ongoing pelvic pain. That is a sign that there's some imbalance, and if you just kind of put up with it, then at some point it'll you know, come to manifest itself again. If you got pregnant again, then you'd have things a lot worse off in your second pregnancy, or you know, things can come up later in perimenopause, menopause. So it's really, or when you start exercising. So it's really worth doing some balancing work after baby, and not just putting up with pelvic pain niggles that you think, oh well, these might eventually go away. You know, I'll see women who've had it for maybe 2-3 years, and they've just kind of been waiting for it to go away, and it's just like, actually you probably only needed 1 or 2 sessions and it would be sorted. So it's just worth being preventative as much as possible about these things. What else do I see? Postpartum, you know, just kind of emotional trauma. I see a lot of. Often women aren't necessarily coming to me with that, but it kind of gets revealed. But I think more and more actually women are coming to kind of, they know they just, something just doesn't feel right, and they want to kind of process it. So yeah, I'm trying to think what other sort of things, like diastasis recti and, you know, core strengthening. I refer to some really good PTs who work around here who do core strengthening work, and their details are on my website. But there's a lot of kind of balancing work you can do to support that as well. Getting things like, again, people don't usually come with this, but it's often an issue, but things like diaphragm function and like your breathing, restoring that. Often, you know, from pregnancy, if baby's been very jammed up and restricted in pregnancy, which again, getting work done during pregnancy can really help to avoid that. But you might, you know, I often see women whose diaphragms are still really stuck and the organs are still really stuck, and yeah, it's like, if you don't feel like you can breathe quite well afterwards, it might be there's just a little bit of body work to do that. They're the kind of main things I'd say.
I think that's so great to acknowledge that, you know, what you're saying is with the pregnancy and the birth, the body goes through such a transformation, doesn't it? So quickly actually through the birth that sometimes things do get stuck and, you know, they're not aligned, and sometimes we just need a bit of help with that. I think that's not always acknowledged. I don't think we really talk about that much, actually.
Another common thing actually is like this whole, you know, shoulders being tight, the upper back being tight, you know, wrists getting weak and achy. So I see a lot of that as well. And again, a lot of that is just, if we can just restore the balance, restore the movement, just, yeah, start developing some good habits. It's, yeah.
Months of breastfeeding and we end up like this, don't we? It's so true. Let me just check in, ladies. Anybody like to ask anything else? You're very welcome. We've got Becky for about 5 more minutes before we have to let her go. We're all good. Oh, everyone's looking very content. Becky, thank you so much for your time. It was a beautiful overview, really brilliant, of some of the healing work that can be done postnatally, and actually just knowing that there's people out there that can help. That's ace. If anybody wants some support, you can find Becky at RebeccaDavies.ost.com. She's amazing and she practices in Walthamstow. And yeah, thanks for your time, Becky. It's been brilliant.
All right, my lovely. Take care. Lovely to meet you all.